with the new technologies.
We need to adjust the anti-diabetic medications once we have corrected the hyperthyroidism in these patients. This is important. In hypothyroids, what do we do? So in hypothyroids, LT4 once again remains the monotherapy, same across. There is no change in that. But only thing we should be aware of is that when the sugars are not controlled, uncontrolled sugars may affect the effectiveness of the LT4 therapy. So however much we may give the higher doses of LT4, the thyroid hormones level may not come to normalcy because of the uncontrolled sugars.
Common risk factors for fungal infections, we all know: diabetic patient, glycosuria because of any cause, poor hygiene, inadequate hydration, and obesity itself, abnormal urinary.
Hi, I'm Dr. Manisha Sahai. I'm Professor and Head of Department of Nephrology at Usmania Medical College and Hospital, Hyderabad. Today, on this day, I'm standing here because we have all assembled here for the EvaStride conference. And what does EVA mean? EVA represents the power of women. And this conference is unique because it focuses on issues related to women and women health, which were very often neglected in the past. And I congratulate Dr. Lily for inviting me to be a speaker in this conference. I have been attending the lectures since morning, and I'm so happy that the lectures are very practical. They focus on the diseases in women. And what I have come to understand, what is the essence of all these lectures? What are we trying to teach the public? What are we trying to learn ourselves? One basic thing, that doctors are there for treating diseases, but health is our own responsibility. And what do I mean by that? Health means you have to take care of your weight. You have to take care of yourself. You have to take care of yourself in the way that at least take out 30 to 45 minutes of your busy life for yourselves. Not for your family, not for your children. Do take care of them, but take care of yourself. You are also important. Women suffer from a host of kidney diseases. They suffer from liver diseases, heart diseases, diseases of the brain. So many diseases, bone disease in women. And very often we have been neglecting them. Women, they are multitaskers. We take care of the family, husband, our parents, our in-laws, our children. We bring color to life. We cook, we clean, we do everything, but we neglect our health. So here I am speaking not only as a doctor, as a health professional, but as a woman as well. And in my talk also, I'll be focusing on one of the drugs, that's SGLT2 inhibitors, which are very important drugs for kidney protection, heart protection, and overall prevention of diabetic complications. So in all my lectures, I lay emphasis on a healthy lifestyle because drugs are there, but lifestyle is important. And my message to everybody on this day is follow simple commandments. Sleep 6 to 8 hours per day, drink 6 to 8 glasses of water per day, maintain a healthy body weight. And what is healthy body weight? Your height in centimeters minus 100. So my height in centimeters is 160. So what should be my weight? 60 kg. And I am also trying to achieve that. In addition, have a healthy diet, less salt, less oil, half liter oil per month, not more than that. Cut down on carbohydrates, white rice, maida, salt, sugar, all white items, white bread.
Stress is defined as physical, chemical, or emotional factor that causes physical and mental tension and may be a factor in many diseases. In fact, several diseases can be caused or worsened by stress, and diabetes is also one of the important one among them. Stress stimulates the release of various hormones which can result in elevated blood glucose levels. Although stress is an adaptive mechanism in the short term, we all require stress response, that is fight or fight response, whenever we come across a dangerous situation or difficult task. But the problem arises only when the stress is prolonged. This adaptive mechanism can become a maladaptive mechanism and it affects the holistic health of an organism. I strongly believe health means holistic health. It is like physical, mental, emotional, and spiritual or energy. All these components are a part of health. So, when we manage our emotions well, there are certain markers which also be in a normal range. When people are stressed, emotional stress is high. It has been shown that so many markers like which promote inflammation like interleukins, tumor necrosis factor, all this will be high and insulin resistance also increases in a person. And a hormone called cortisol and catecholamines also increase. So nowadays I come across many diabetic patients who are considerably eat well and who are physically active but are not able to manage the blood sugars well. The main reason for this is heightened emotional stress and also lack of sleep. When the cortisol and catecholamines rises and inflammatory markers rises because of emotional stress and lack of sleep, however good you eat and how physically active you will be, still your blood pressures will not be under control. Please make it a point to note down that stress and lack of sleep are playing a major role in the metabolic health of a person nowadays. Especially, it is conducted and found out in various scientific studies that women are at more risk when compared to men when it comes to emotional stress and lack of emotional support, especially at workplace. I'm extremely honored to talk on this special topic at EvaStride National Conference. The message for the global audience would be it has been quite a long time, it has been, even the medical fraternity or the general public, the focus has been much on the physical aspect of the body. But we have diverse other aspects of health like mental, emotional, and also energy aspects of health. So let us not look our health in a dissected way, but let us look at our health in an integrated way. So this is a message I want to all of the global audience to understand that health means holistic health. So let us focus and see our body as an integrated one rather than looking at it in bits and pieces. So your focus mainly on physical health helps to maintain the metabolic parameters. Also, we need to concentrate more on managing our stress and properly sleeping well so that we can achieve holistic health. Power of negative emotions. Most of the times, are negative emotions good or bad? Most of the times, we are of the opinion that negative emotions are bad. But every negative emotion has some story to make us think.
I am Dr. Lily Rodriguez, the founder and the chairperson of this conference called EvaStride. And this is our sixth endeavor. Every year, annually, we have this conference which where we select a particular theme on women's health. We are dedicated to women's health, and every year we select a new theme. So this year we have selected a theme called women's empowering the women's health towards metabolic excellence. So all our topics are geared towards this metabolic topics, which will help clinicians from all areas of all specialities, to deal with their practical problems when it comes to metabolic issues, because they are the metabolic syndrome, so we say, which includes obesity, insulin resistance, dyslipidemia, which means cholesterol abnormality. These are the various areas where we are concentrating upon, and where the people from different areas, including hepatology, liver, all these topics have been selected, and speakers have come from all over the country. We have about 16 speakers coming from different states from our country, and deliberating on all these issues from morning till evening. Will be there till 6 p.m.